Hello guys and welcome to another tutorial video of psychiatry. So in this video we'll be discussing about the different psychoanalysis and different psychological theories. So basically the important of this psychoanalysis and psycho theories is in order to understand and read the subconscious mind. So firstly let's begin with what is psychoanalysis. So psychoanalysis is defined as a set of theories and therapeutic techniques related to the study of the unconscious mind, which together form a method of treatment for mental health disorders. So, why psychoanalysis is important? Because by studying the subconscious or the unconscious mind, we are able to understand what sort of treatment or what sort of medication is to be given to the psychiatric patient suffering from a so and so psychiatric disorder. So, by studying this, a proper sort of medication, the right treatment can be given to the patient. So, the patient cures fully and shows no further signs of this psychiatric disease. So, yeah, the psychoanalysis was first brought up by an Austrian neurologist called Sigmund Freud, and partly with the clinical work of Joseph Proof and other scientists. So, psychoanalysis was later developed in different countries by different directions, mostly by students of Freud, such as Alfred Adler and his collaborator Carl Gustav Jung, and other scientists. So, psychoanalysis is a controversial discipline and its validity as a science is contested. Nonetheless, it remains a strong influence with psychiatry, more so in some quarters than others. So, psychoanalytic concepts are also widely used other the therapeutic arena, in arenas such as psychoanalytic literary criticism, as well as analysis of film, fairy tales, and other cultural phenomena. Psychoanalytic psychologists see psychological problems as rooted in the unconscious mind. So, the patient doesn't really know he has this psychiatric disorder, but this only the diagnosis of such psychiatric diseases can be identified by such clinical psychoanalysis by reading the subconscious mind, meaning when the person is not in his senses and his subconscious mind takes over. So what happens, the manifest symptoms are caused by latent disturbances. Typical cause include unresolved issue during development or repressed trauma. So trauma plays an important role and is known to be a major factor in this disease, in generally most of the psychiatric disease. So what happens is a child generally suffers from trauma such as being um, thrashed by his parents or seeing too much of violence on his mother by his father. So yeah, trauma experience during childhood plays an important role in psychiatric disorders. So how can we understand the unconscious mind? So what we need to remember is psychoanalysis is a therapy as well as a theory. So psychoanalysis is commonly used to treat depression and anxiety disorders along with the medication. So in psychoanalysis, Freud have had to have a patient. What happens is Freud, the scientist to discover psychoanalysis or is known to discover psychoanalysis, would have a patient lie on a couch to relax, and he would sit behind them taking notes while they told them about their dreams and childhood memories. Psychoanalysis would be a lengthy process involving many sessions with the psychoanalyst. Due to the nature of defense mechanism and the inaccessibility of the deterministic forces operating in the unconscious, psychoanalysis in its classic form is a lengthy process often involving 2 to 5 sessions per week for several years. So what happens is the subconscious mind, in order to read the subconscious mind, it is very difficult and it is also a very lengthy process in order to clearly understand what the patient is actually suffering from. Because the main defect in psychiatric disorders is the symptoms are very similar for many of the psychiatric disorders. So in order to get the pinpoint disease, what we need, a clear, thorough studying of the psychiatric mind is very important. So basing tenets that are found in a psychoanalysis or what a psychoanalyst believes is is that a person's development is generally determined by often forgotten events in early childhood rather than by inherited traits alone. So it is not alone genetic, but like I said, by trauma that is experienced by the child during his early childhood. Human behavior and cognition are largely determined by instinctual drives that are rooted in the unconscious. Attempts to bring those drives into awareness triggers resistance in the form of defense mechanisms, particularly repression. So the use of this in practice, it involves during psychoanalytic sessions, which typically last for almost an hour or 50 minutes, and ideally takes place around 4 to 5 times a week. The patient or the analysand, which is also called an analysand, may lie on a couch with the analyst often sitting just behind and out of sight. So, this is because the patient needs to feel fully secure and fully confident. And so, in order to relax the patient more, the psychoanalyst, what he does is he gets out of the sight of the patient and sits just behind him in order to take, and he takes notes. He takes notes because he needs to write uh, all the symptoms that are shown by the patient, and tally those symptoms with those of the psychiatric disorder, and provide certain medication towards to the falling disorder. So yeah, also the tenets also include unconscious material can also be found in dreams, unintentional acts including mannerism and slips of tongue. Slips of tongue is when an unconscious mind takes over. So, liberation from the effects of the unconscious is archived by bringing this material into conscious mind through therapeutic interventions. The centerpiece of psychoanalytic process is the transference whereby patients relive their infantile conflicts by projecting onto the analyst feelings of love, dependence, and anger.